So we're going to move on to our next presentation by Dr. Patrice Simmons Brooks, who is a holder of a bachelor degree in biochemistry and medical sciences from the University of the West Indies. And she has enjoyed working at the sickle cell unit at the University of the West Indies as a medical officer for the past 5 years. Her research interests include women's health and public health policy for persons living with sickle cell disease. And her philosophy is excellent healthcare is a human right. So true. So please welcome Dr. Patrice Simmons Brooks.
Okay, good afternoon, everyone. Okay. All right, so today I'm going to focus on health and wellness, adult health and wellness in sickle cell disease. When I was initially invited to speak, I basically wanted to explain why we do what we do. When you come, especially adults, you know, most adults are like, why I need to come? I'm not sick. But it is important that you understand that a part of being healthy, you may not have good health, you may not have health, but you must be health seeking, you know, and that is a very important, you know, policy and tool that we use in public health. You may not be 100% healthy, but you can practice health seeking behaviors, and that is a part of what wellness is. So the WHO defines, today we want to define health and wellness. We talk about health maintenance in sickle cell disease, and we want to talk about some of the treatments and curative options that we have. I'm not going to focus too much on the curative options because I see where other presenters will, but I'm going to focus on treatment, mainly hydroxyurea. So the WHO, and I'm sure many of us have seen this definition before, but it defines health as the state of complete physical, mental, and social well-being, and not just the absence of disease. And when you look at this definition, most of us are not healthy because, you know, it says complete. But we can practice to be, you know, practice wellness, and wellness is the state of living a healthy lifestyle. There are several components to wellness. You have environmental wellness, intellectual, emotional, physical, social, spiritual, and occupational wellness. And I really want, you know, our sickle cell warriors and our persons supporting persons with sickle cell disease to focus on more of wellness than just being completely healthy, because that is a standard that most of us, even persons that don't have sickle cell, you know, in Jamaica we're looking at statistics for hypertension and diabetes that are very high. So most of us aren't healthy, but we can practice wellness. So sickle cell is not only about pain. And if it's one thing you should remember when I leave here, I want you to remember that it's not only about pain. So when we send you for those blood tests and you're like, Doc, but I came for the pain, I want you to understand that there are other complications to sickle cell disease. The pain, you know, it is a very, you know, troubling part of having sickle cell disease, but it's not the only, sickle cell is not only about that. As Prof says, everywhere you have that the blood goes, it can have a complication. So these are just some of the complications of sickle cell disease. I just want to focus on a few. Prof focused on the neurocognitive dysfunction, you know, such as stroke. Neurocognitive dysfunction doesn't necessarily have to be stroke, but sometimes you have children that they present and the mommy said, Mom, you know, this child used to be very fast in school, and then we notice that the child isn't learning as quickly, and then when we do the TCD, we notice that the TCD, the transcranial Doppler level, the blood flow is high, and that child may have had a stroke, but it's like a silent stroke. So be aware that the stroke doesn't necessarily have to present with the slur speech. There are other subtle things that you can see when persons have a stroke, and look for that also in adults. If it is that you have a relative and they used to be very good with numbers, and then further down the line they are not so good, or they appear slow, or they're developing dementia in early years, you know, encourage them to come to the sickle cell unit because it may be one of the complications. We have things like sickle hepatopathy, which is liver disease in sickle cell disease. We have gallstones. Persons can develop priapism, as Prof spoke about earlier. Bone marrow infarctions, which you can end up having avascular necrosis, which is a painful hip problems. Foods to avoid. Everybody is into sushi and love to go to certain Japanese restaurants, but just remember that foods that are raw, salmonella is something that sickle cell patients are sensitive to, and we want to avoid eating raw. No, going to the restaurant and having medium rare. No. Bun it up. That's what I tell the persons. Make sure that the food is properly cooked. And it's important to practice good hygiene. Cook the food thoroughly, wash hands, especially if it is that you have a diarrheal illness, come in, but also make sure that your food is safe. So as I was saying before, in terms of vaccinations, we offer Pneumovax at the unit for $2,500. That's pretty cheap. Prof had quoted a figure for the Prevnar, but I've seen Prevnar 13 vaccine as much as $20,000. Yes, I've seen persons. Recently, for children, they may give it for $8,000, but I've seen between $13,000 and $20,000. What I see. What I tend to do for the patients is that I write a little prescription, send them to the health center, and write that they have sickle cell disease. And 9 times out of 10, you get it at the health center for free. DT, so that is the lockjaw vaccine. Every 10 years, you need to get it. And we tend to take advantage of, if it is that you come with an early leg ulcer, if you come to the unit and you have an early leg ulcer, we will give it to you for free. But this vaccine is not very expensive, about $3,000, $4,000. Hepatitis B is a series. Persons under 20 years old tend to have this vaccine because the government, have included that in the schedule. But if you're older than that, you may not have that vaccine. So if we don't see that on your vaccination sheet, we tend to tell you to get it. It's 3 vaccines, you get 1, then 3 months later, then 6 months later. And hepatitis is an inflammation of the liver. It's a viral illness. Influenza, yearly. And I can't stress this more, especially if you have asthma and sickle cell disease, yearly flu vaccines. We are expecting to get some of this from the government, and you can come in, call every 2 weeks and ensure that we give this one free at the unit. You can go to any health center and tell them, I have sickle cell disease, and you should get it for free. HPV vaccine, and a lot of patients have come and asked me, Doc, what do you think? I'm a sickle cell patient, and should I take the HPV, that is a human papillomavirus vaccine? I say yes. If you are sexually active, you should get that vaccine. Cervical cancer, sickle cell disease does not protect you against cervical cancer. You can get it. You can get genital warts. If you are sexually active and you're having unprotected sex, take the vaccine. Meningococcal vaccine is a vaccine that we see when persons are going for their splenectomy. It is recommended, but it's not available locally, readily. You'll have to order it specially through the NHF. But if it is that you're going overseas and you have health insurance, Medicaid or Medicare, you can go and get that vaccine. It is helpful. Now, going on to reviewing of blood work. As Prof has mentioned before, the steady state. So I had a lady call me after 20 years of not coming to clinic, and she asked me for her steady state. I told her, I can give you a steady state, but it may not be your steady state. A steady state is the average of your well bloods, right? So if you haven't been to clinic for 20 years, I cannot give you a steady state. So you need to come. That's why we ask you to do your yearly blood so we can take an average of your well bloods. So if it is that you come to clinic only when you're sick, you won't have a steady state. So average of your well bloods over time, that is your steady state. You have a steady state for your white cell, steady state for your hemoglobin, steady state for your platelets, steady state for most blood indices, and we also have a steady state for your oxygen level. Kidney function tests, and the kidney and the liver function tests, they tend to be expensive. We're looking at $8,000 to $9,000 or probably more, but it's important. We have in terms of the kidney function test, we look at the albumin creatinine ratio to look at if it is that you are at risk for kidney disease. if you're at risk, there are medications that we can start you on that will help to protect your kidney from further damage. And that's what we want. We want prevention. If you have seen a patient on dialysis, you know why screening for renal disease is important. That the kidney test may cost you $8,000 or $9,000 a year, even if it costs $20,000 a year. $20,000 is what you will spend on dialysis in 1 week. Yes. So, doing the test where we can screen you and we can start you on the ACE inhibitor, if we notice that you're at risk, that $20,000 that you're bawling about can save you. Other important tests, hormonal testing for persons with delayed puberty, HIV and syphilis, very important. Your pap smears, we don't do those at the sickle cell unit, and your prostate-specific antigen for men over 40. Important consultations include eye clinic, and this should be yearly, dental twice yearly, and people are like, why I need to go to dentist if I have sickle cell disease? Why it's important? A cavity can turn into a dental abscess. A dental abscess can cause osteomyelitis of the bone. Osteomyelitis is a long-term thing. That is you being admitted for IV medication for months. So, you know, those who are in a full-time job, imagine you having you could go and fill the teeth for $10,000 and you wait until it becomes infected into the bone. You're spending 3 months in the hospital to clear up an osteomyelitis. Renal clinic, if it is that we find that you have impaired renal function, we do refer you to the renal clinic, family planning clinic, and this is very important for both men and women. If it is that you have had pneumococcal septicemia at some point in your life, we recommend that you go on lifelong penicillin prophylaxis. So that means that we put you on penicillin for life. Most people, when they get to age 4, they get the pneumovax vaccine and that's it. But if it is that you develop pneumococcal meningitis or pneumococcal septicemia, that is pneumococcus in the blood, we recommend that you stay on penicillin for the rest of your life. Some persons will develop heart disease related to sickle cell disease. We call that sickle cardiomyopathy. And we may have to refer them to cardiology clinic. If we listen now, we hear a new murmur. There's an echocardiogram available at the unit. The cost is just $8,000, and echocardiogram can run you anywhere between $12,000 and $20,000. So it's highly discounted. Orthopedic clinic is with Dr. Vaughn the second Friday in the month. Urology clinic is the last Thursday of the month. And we don't see pregnant patients. If you come and you're pregnant, you come for your regular routine visits, but we don't follow up your pregnancy. We refer you to the high-risk clinic or the ultra-high-risk clinic. So, general treatment of sickle cell disease, and I asterisk hydroxyurea because I'm going to spend some time in talking about hydroxyurea. There is an orphan drug status on L-glutamine, and that's Endara. I see somebody's going to speak on that. There's gene therapy and stem cell transplant, bone marrow transplant, and just your general analgesics. Specific complications, as I say, we have treatment of it is laser surgery. For gallstone, we have laparoscopic versus open removal of the gallstone, and for spleen, removal by splenectomy. So this is what I call the wonder drug. I really, I am one of those doctors that I really believe in hydroxyurea, and I see that we are developing an army of persons that believe that hydroxyurea is a good thing. I remember a few months ago when hydroxyurea was short in the island. If I said my phone rang less than 30 times for the day, I'd be lying. Parents were panicked because they remembered life before hydroxyurea. So they wanted to know where you had people coming from as far as Mobay to come to a pharmacy beside Andrews to buy hydroxyurea because they remembered life before it. Hydroxyurea is not a new drug. It was first discovered by Dressler et al. In 1869, and it was initially used as a cancer drug. What they noted is that these cancer patients had an increased level of fetal hemoglobin, and they said maybe we could use this in diseases like sickle cell disease. So in 1984, Platt et al. Published their findings, and they found that hydroxyurea increased fetal hemoglobin. Fetal hemoglobin is unaffected by the mutation that causes sickle cell disease, so the cells stay round and are not sticky. It increased hemoglobin, and it increased fetal reticulocytes, so you will have less symptoms of sickle cell disease. Just to tell you, this drug is not new. It is tried and tested. We've had many studies still going on in the unit, and I always tell persons, I have 2 children, and if they had sickle cell disease, they would be on hydroxyurea, no joke. So it's a drug that is tried and tested. It's the only drug that is currently approved by the FDA for the management of adults with sickle cell disease. It has no FDA approval for the management in children. However, there are multiple studies that tell us it reduces the risk of stroke, reduces the painful crisis, reduces painful crisis in children. And we have used it as far as 2002 for patients. We have close to 200 patients on this drug at the unit, mainly children. So how does it work? So it works at the level of the red blood cell, and also it has vascular effects. But long and short, it decreases the amount, it decreases vasoconstriction, it increases hemoglobin, and that leads to increased tissue oxygenation and decreased inflammation. So you get less symptoms of sickle cell disease. So why is hydroxyurea a good option? Many of the complications of sickle cell disease are treated by transfusing. And we see every day people come and they're begging. We have a shortage. I had a friend that, her mother was on Tony Tweets, close to 2 weeks waiting for B positive blood. And, Jamaican people, remember that blood, even if you give a lot of blood, it's something that is perishable. So we want to ensure that, remember, when you get blood, there's a complication of the transfusion. Hydroxyurea is going into your bone marrow, increasing the amount of fetal hemoglobin and allowing you to have higher levels of hemoglobin, preventing your blood from sickling. So it is preventing not only the acute complications of sickle cell disease, but also the chronic complications of sickle cell disease. Bone marrow transplant, that it's very expensive. When we look at bone marrow transplant, it's about $100,000 just for the treatment. We're not talking about the immunosuppressants and all of those other things. That is $100,000 US for just the treatment, and it's not available in Jamaica. So when we look at hydroxyurea, that it can cost you from as little as $2,000 on NHF to about $12,000 Jamaican, that is 100 US, 20 to 100 US. And then we look at the cure, which has its risk and still quite experimental when we look at how long it has been around. We have to, look at benefit and risk, and this is a good option for persons with sickle cell disease. I love to show this graphic when I'm doing my presentations, and if you can see, slide A is somebody that is not on hydroxyurea, and this is the blood of the person while for hydroxyurea, we increase the dose over time until we get to something we call the tolerated dose, right? The maximum tolerated dose, right? Or the maximum therapeutic dose, right? So we start at A, where we see lots of sickle cell, little bit of cells, so we see that it's an anemic slide with lots of sickle cells on it. And when we look at slide F, you have to be looking, you have to be looking hard. And that F is that patient at MTD. So we can see at the level of the blood that hydroxyurea is a good option for you if you have sickle cell disease. Other things that you'll notice when you're on hydroxyurea, many people, their eyes clear up and you can't really tell. They have less pain, they gain weight, and the outlook on life is a lot more positive. What are the criteria for hydroxyurea? So anybody who's greater than 2 years old with a severe genotype, so if they have HBSS or STAL0, if it is that you have recurrent or severe vaso-occlusive crisis, recurrent acute chest syndrome, persistent symptomatic anemia with no underlying cause, if it is that you have history of stroke or history of an abnormal transcranial Doppler, come in and speak to us about hydroxyurea. If it is that you have a child that is very sick, you know, lots of complications before age 9 months, come in and talk to us about hydroxyurea. If it is that you have an abnormal renal function test, so lots of protein in the urine, you would qualify. Chronic low oxygen levels in the blood, you're a candidate. If it is that you come and just want to go on hydroxyurea, you're a candidate. Who is excluded? Persons that are pregnant, persons who want to get pregnant within the next 3 months, failure to use an acceptable method of birth control. If it is that you don't come to clinic, you come in once a year or none at all, no. If it is that you have an abnormal liver function test, you are not a candidate for hydroxyurea. Some of the barriers, and this is where I'm going to close, we have the cost of the drug. As I said, before it was on NHF, it would be, you know, $12,000 to $20,000. Now people are paying as little as $2,000. Some people go to the health center and the doctors rewrite it and they get it for free. You may miss school or work when you have to come for the visit, the initial 6 to 9 months where we try to get it to MTD. Many doctors outside of the clinic are not trained to manage hydroxyurea. If it is, we find that people may be compliant when they are children, but when they have to take it on their own, they don't. You know, adults just don't like to take drugs. Lack of knowledge of the option, you know, adherence, especially in teenage life, and fears of the side effects. And just recently, I saw a study that spoke about the risk of cancer, and they are saying that the risk is very low. So, yeah, we haven't seen any cancers, and we have people on hydroxyurea close to 20 years, and without hydroxyurea, they may have died. You know, they may not have lived that period of time. So, just in closing, just gonna speed to the end. Sickle cell disease is a treatable condition. Persons living with sickle cell disease are encouraged to be health-seeking. More treatment options are currently available, and the cure for sickle cell is in sight. We've seen it in time, but we want a little bit more research, and it is within reach in persons with sickle cell disease. I thank you very much. I'll see you in another hour.